Guys, welcome back to Medical Coding with Blue. Today's episode is all about Z-code study hacks. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so the Z codes. A lot of medical coding students and even medical coders out there still get confused with Z codes. So today's episode, I'm going to be explaining 3 ways how you can learn the Z codes better and when they should apply and where to find out more information about them. But I will start off by saying this is the star of our show. This is not an ad for Optum. However, when it comes to my personal recommendation for good tools for medical coders, Optum is up there. They are supreme. Out of all of the other ICD-10-CM versions, I believe that Optum has the best one when it comes to ICD-10-CM. Now, this is the ICD-10-CM Expert for Physicians. This is the 2024 edition. If you do not have this Optum book, you can still apply these study hacks for the Z codes. But this book is where I'm going to be showing you how to learn them. So without further ado, here we go. All right. So we're going to first jump all the way, hack number 1, we're going to jump all the way to the back, okay? And I've always told you guys that exploring your appendixes in the ICD-10-CM book are very important. Now, this is Appendix D like in dog. These are the Z codes only as principal or first listed diagnosis. What I recommend your first stop is to look up every single one of these Z codes and find out what they are. Just so that way you can have it in your brain, you can have it in your mind, it can be there. Because when you are going through these Z codes and you're looking at these encounters, sometimes people are missing these first listed Z codes because they don't know. They don't know they're there. They just look at the diagnosis. They just look at, oh, okay, well, this was selected, so I'm going to go ahead and check this off the list. And it's not so. It's going to be, well, do we know that this should have a Z code as a first listed diagnosis code? And the only way you're going to know that is if you know and familiarize yourself with the Z codes. So that's my first recommendation, is to take a look and look up every single one of these Z codes. So that way you can have it in your mind and you can be ready when you are looking at these encounters. Because I'm looking at these Z codes right here, and I know what a lot of these are. Now, some of them I have to look them up because I don't remember what all of them are. But one of them that I see is the preoperative examination Z code. The other one is the follow-up after completed treatment. And then there's another one for follow-up after completed treatment for a neoplasm. So there's a lot of different various things that these Z codes cover, but it's very important for you to know about sequencing. And these ones are going to be like your principal or first listed diagnosis. Yes, there are some times where things get a little bit different when you're reading the guidelines, but for simplicity's sake and because I know I'm talking to a lot of brand new coders, let's just get the idea of what kind of Z codes we're looking at in the first place, okay, to be the first listed diagnosis code. And then we can get into some deeper things later on when you're studying and things like that. But for the most part, look all these codes up right here, so that way you've got a good idea of what kind of Z codes are going to be listed first, okay? That's your first stop. Now, the second is going to be, and this is the thing that I love about Optum, is at the beginning of the chapters, they have the chapter-specific guidelines, and then they also have the scenarios, they have the answers, and then they have the explanation. So that's what I love about Optum, is because they explain all of these things. So you can be reading these guidelines and then you can see the examples in between. My recommendation, if you watched my other video about study hacks for ICD-10-CM, learning it, was to cover up the answers and then look up the codes themselves and then check and see if you got the correct answer. And then you can look at the explanation if you did not get the right code, or if there's something that you were maybe confused about, it's going to explain it here. So I think that's the best way to learn the guidelines anyway as well, because you're going through each chapter. This is the chapter specific guidelines. So you definitely want to check this out, and you definitely want to cover up these answers right here and make a practice of doing this. Some people have said, well, I had my spouse go in and cover up the answers so that I didn't have an idea of what the answers were. So, hey, you know what? That's great. If there's somebody in your family that wants to help you in some way, and they just want to be a part of your learning process, and maybe they are not interested in doing flashcards, but this is something that they can help you out on, that's definitely something that you should take them up on. This isn't just your journey. It's a lot of times it's going to be those around you. And sometimes it is just your journey. So it really all depends on your home situation. But if you have kids that want to help, if they're in that perfect age where they want to help you and they're not into their teenage years yet and they just want to do their own thing, if they're in that perfect age where they want to help you and you want to give them a task to be a part of it, have them go through with a sticky note and cover up the answers. So that way you can just have access to the questions. And then when you're practicing, you can just take off those stickies later. So that way it's not just right there in your face what the answer is, So that's just one of the other things that you can do, because again, it is going to be a team effort, especially if your kids want to help, or somebody, your spouse or significant other, wants to help you. Let them help you. That's one thing that you can have them do. And maybe if they understand what it is that you're doing, the magnitude of what you're doing, maybe they'll support you even more. Okay, so just my little bit of advice. And yes, I derailed for a second, but whatever, what are you going to do? But that is the second best thing that you can do, which is to look at these guidelines and do these practices in between. Okay, because there's a lot of them. You see, this is the second page of them. And then it gives you a lot of just explanations about the different things. So what the Z codes cover, and I should have said this from the beginning, but here we go. The Z codes cover like the encounter for, and it tells a lot more of the history of. So there's a little bit more of the story that gets told with these Z codes, the why the patient is coming in. Like I said, there's like those preoperative encounters, and there's those kinds of follow-up things and things like that. So those are some of the things that you can relay when you're telling the story in codes with these Z codes. All right. Now, some of these Z codes are known as social determinants of health. There are Z codes for those as well. And that talks about, just different things that could potentially impact a patient being cared for if they are homeless or if there's food insecurity. Those things are covered also in these Z codes. If a patient has a history of military deployment, that's also covered in these Z codes. And sometimes these Z codes that are additional parts of the story that can be found throughout reading the note, when you pick these up, what happens is when this data person goes and they run these reports, and these reports are going to talk about, like, okay, if we have this many patients that have that came in for a pre-op, what is our percentage on patients that come in for pre-op? And then they can pull a report that has all the Z01818 codes right on it. And that's going to tell them, okay, we've seen this many preoperative encounters, and it was, whatever the data they want to pull. But it's very useful in them planning. And so it's our job, again, as coders, to be able to code and code correctly. Not every veteran coder is always going to have the answers. And not every new coder is going to be so lost, because sometimes new coders study really well and they know that there's supposed to be some Z code picked up and maybe a veteran coder has forgotten. So never dismiss anybody when they're saying something about Z codes. Okay, that's why I'm saying that you have to familiarize yourself with what else can we pick up as far as like what else is here that's telling more of this story. Every patient is going to have a story told in these codes, and you want to be able to pick them up accurately. And the third thing that I will say is taking the time to, after you've looked up all of these Z codes that are the primary or first listed, and then after you've done all these exercises here at the beginning of the chapter, then you want to go through and look at each and every single page. Now, you're not trying to memorize all of these codes, but what you are doing is you're familiarizing yourself with what is available here. Now, what I have seen a lot of errors happen with students is that, especially when it comes to mother-baby, there's a lot of people that get confused about which Z codes apply to which. So for some, Z codes are going to go on mother, and some Z codes are going to go on baby. But in order for you to know that, all of that information is going to be here. And you're going to notice throughout this chapter as well, there's going to be some notes that says use additional code. And so those are the things that you want to pay attention to when you are coding. Because of course, you're always going to look your code up in the index, and then you're going to come back here to the tabular, and then you're going to see if there's any guidance, right? You're going to look at the guidance that's around the code, and then obviously you're going to go to the beginning of that section and see if there's any guidance that it does have. So right here where we have the Z08, which is encounter for follow-up examination after completed treatment for a neoplasm. So then it says right here, use an additional code to identify like an acquired absence of an organ, like if they took an organ out, right, because they had a malignancy there, there's a Z code for that. Then you would code an additional code. Whenever it says use additional, what it's saying is, I know you can't really see it. Guys, I'm not that good with camera stuff, but if you're looking at your book right now, you know, okay? Z08, you can look at it. But if you look at that right there, and it says use an additional code for an acquired absence, if the documentation is stating that they had, this organ removed because, they had a malignancy here, that's what you're going to pick up. Okay, you're going to use an additional code. Use additional means this one's going to go first, then you're going to see this next code right here, right? And then it also says use an additional code to identify personal history of malignant neoplasm. So then you would also pick that up. Okay, so if any of these things apply, you want to be able to pick those up, all right? And following these directions here is going to make sure that your coding comes out correctly, and that when you are submitting these to the billers and the billers are going on and submitting them, that they're going to come back clean because they had all of the information there that they needed, okay? So just something you ought to know. Now, something else that's in the Optum books, I'm going to creep this forward as much as I can. But people have asked me about these before. Let's see. Can you see me? All right. Right here. Yes, you can see me. All right. Where it says AHA and it says, or it says AHA 2022 3Q4, and then it says 2021 1Q33. So what this means and so on and so forth. 2020, 2017, 2015. So what it means, 2022 means there's an AHA coding clinic. The American Hospital Association, there is a coding clinic that somebody sent in a question, and there was some guidance put out from the people who manage this book, right? So, or the code series. So it's AHA 2022. In 2022, this happened, and that would be in the third quarter. Okay. So that's breaking that down. So if you see that and you need more information, that's where you can go. Okay. So, but that's just something I wanted to point out really quickly. See, and then here we have definitions, right? So it'll tell you DEF, obviously. But this one is for genetic susceptibility to multiple endocrine neoplasia, right? So it's explaining here more of what this is. So again, when you're looking at these notes, you need to realize, why did this patient come in? And when a doctor is documenting patient history and it is relevant to the reason that a patient is getting care. For example, if they're doing a screening because they have a high risk family history of colon cancer, right? So then you would pick that up, because a lot of times that's going to be the driver for some of these encounters to happen, is because they have to, it was because they have family history. And so they wouldn't otherwise normally have this, but because they have a family history, it increases their chances of having this condition. So that's why we want to make sure that if it's documented, we're going to go ahead and pick up that family history. And those family history codes are back here, as well as personal history codes. And personal history, you want to pick those up when it's relevant to what is happening with that encounter, or the reason that they had that procedure or something. So that's how you're going to know and understand. And after a while, even though I'm kind of going over it kind of fast, after a while you will understand when these apply. But again, you have to get an idea of what codes are available. So that's why you want to go ahead and look at these things, not just read the guidelines. Reading the guidelines is fantastic. I've always told you guys to do that because it's very important. But in order to really understand what is available, you want to look at the codes that are available. And it's not that much that you have to look at. And just to kind of have an idea, like, oh, okay, well, especially here for mother baby, look, encounter for supervision of normal first pregnancy, and then encounter for supervision of other normal pregnancy, and then encounter for supervision of normal pregnancy unspecified. So there's a lot of different options that they have here, and sometimes they will have some pregnancies that are more difficult than others, and sometimes if it's the mother is younger, right, really young, or if they are older. So there's just different ones that you can find in here as well. Let's see, because I'm again gonna run out of time, I swear. But looking at these different codes, you're going to be able to see, again, what is available. And that's the best thing that you can do for yourself, especially if you're going into a clinic like Mother Baby. And then we have here how many weeks of gestation. So we have the codes all broken down. It's broken down all by weeks: 10 weeks, 11 weeks, 12 weeks, gestation of pregnancy. So a lot of these are going to be like very specific. So you want to make sure, especially if you're in this type of clinic, that they are documenting how many weeks gestation that the mother is at that current time, so that way you can pick up the correct Z code for that. And always make sure that you pay attention to those, because sometimes that's the code that gets forgotten, and coders leave that off, and I've seen it kicked back a bunch of times. And this is a very simple mistake, and you don't want to make these simple mistakes, because again, knowing that you need to have this Z code on there for how many weeks this is for this mother, that's going to be, again, the difference between you getting it wrong and you getting it right. So, but yes, so there's that. And then we can just keep flipping here and see what else we can see. So fitting and adjustment of other devices. I want y'all to pay very close attention to that, because there's sometimes when, like, look at this. Encounter for fitting and adjustment of a hearing aid. There's one for a dental prosthetic device, fitting and adjustment. Orthodontic devices, right? Fitting and adjustment. And then gastrointestinal appliance and device. There's an encounter for fitting and adjustment of that as well. So again, it depends on why the patient is coming in. Is this going to be your first listed, or it's not going to apply? You know, again, you got to pay attention to why they're coming in. There's an encounter for fitting and adjustment of an insulin pump. All right. And then a non-vascular catheter. And let's see what else. Oh, and then aftercare following joint replacement surgery. So I've seen coders do this. Guys, you have to be really careful when it comes to ortho. Ortho is one of those ones. I recommend ortho for new coders as well, because again, if you want to be pushed into the deep end of the pool so you can learn the hard stuff and get all the hard stuff out of the way, ortho, the ER, are really great places to go. Family practice is also a great place to go too, because you're going to see a variety of things. And with ortho, you're going to see like the injuries. You're going to see the joint replacements. You're going to get familiar with that type of coding. And a lot of times those orthopedic coding positions are very hard to fill because everybody gets scared of injuries. Nobody wants to do injury coding. Blue, it's so scary. I don't understand it. That's nonsense. It's nonsense, especially when you familiarize yourself with these codes. You start with the Z codes as well. But you get familiar with these Z codes. You get familiar with the injury coding. And you are going to have offers all the time. Every time I go to conference for AHEMA, I always get the same question. They find out that I'm an orthopedic coder and they're like, "Ooh, are you interested in working for us?" I was like, "No, thank you." But the reason that I say this is because I'm happy where I am. And for some people, again, they struggle to find those because it's hard to find competent people to code for ortho because, again, you have to know about organic conditions and you have to know about injuries as well. So, again, if you familiarize yourself with all of these things and you get to know, like right here where it says aftercare following joint replacement, right? Surgery. And then use an additional code to identify the joint. That's going to be another Z code. So that Z code is going to go first, that Z47.1, and then you're going to go with whatever joint it was replaced. So, and that's going to be further back in the chapter, Z96.6, and then you have to just put, whatever. And then it says encounter for an organ transplant. You have those there. And then we have persons with potential health hazards related to socioeconomic and psychosocial circumstances. So there's an AHA thing right there where you can find more information. Then there's a definition there. And then there's a tip, right? Because that's, again, why I love Optum, because they give you these tips in between. And so the tip here, it says, because codes in these categories represent social information rather than medical diagnoses, they can be assigned based on documentation by non-physician clinicians involved in the care of the patients, as well as self-reported documentation from the patient, as long as the information is approved and incorporated into the medical record by the clinician or the provider. So again, not every single Z code that's going to come up like, oh, it's a Z code. You have to make sure that you know who is documenting it and if it is okay to be picked up by that person, if it's somebody that's other than the provider. Okay, so again, you see that explanation there. Again, a great explanation. But we have a code for inadequate housing. We have inadequate housing environmental temperature. So sometimes when we see those things, it's because like maybe it's the summertime and it's an elderly person who doesn't have air conditioning. That is something that may apply to them. So it really all depends, again, on the documentation and everything else. So let's see. Then we have body mass index. Here's all of those. Sometimes they will have it listed in the documentation and sometimes they won't. But again, if you see that there are things in the documentation, it is your responsibility to do the education. If you see there's things that are missing that can tell more of the story, sometimes you have to just tell the provider about that. This patient is morbidly obese, but there's no BMI documented. These things are important, again, because for statistical reasons, and sometimes these statistical reasons help to develop programs for certain areas, especially if there's like a really high instance of certain things happening. I don't want to say anything specific, but if there's something specific that these Z codes are capturing, there could be programs that could provide education, because health literacy and that kind of thing is very important for people, and it doesn't matter your background. I mean, being literate about your health is really, really important, all right? Because it affects so many other people. It's not just yourself, it's other people around you as well. So before I get on another topic, let's see. So as we keep going here, we have persons with potential health hazards related to family and personal history and certain conditions influencing health status. So then they have those codes there as well. And got a couple more minutes. All right. So then we have all kinds of things. Long-term use is also here as well. And if you don't know some of these long-term, like if they're saying that they're on a long-term medication, if you don't know what kind of classification it falls into, here again is another thing that's so great about Optum, because then you have Appendix B, which gives you a list of all of these medications, right? And it also tells you the classification that it is. So if you see that the patient is on a long-term something or another, and then you can look it up back here, and then you can see what classification it falls onto. And then if they have it as long-term use, then if there's a specific code for it, all the more better, right? All the more better for just clean coding. Okay, so just you need to know that these codes are available, all right? So we have more of our personal history codes. We have allergy status codes. Okay, I know, I'm just trying to get y'all in the camera here. And then we have, and we have acquired absence codes, right? And see all those right there, all right? And we've got very specific codes there too. And we see our code also codes here, and then use additional codes. So again, stuff that you can find out just by going through your book. No one has to tell you. Your supervisor doesn't have to tell you. Your lead medical coder doesn't have to tell you. You have to be able to take the initiative. You see how we went through this whole section right here this whole time while I'm talking, okay? That's how much time it takes. Not much time at all, right? And then again, seeing this here, that way so you know, okay, there is a code for that. That's how you're going to be more familiar, because a lot of people that tell me, oh, Blue, I just don't know when to apply these Z codes. Have you gone through the Z code section? Well, no. I don't know why y'all send me those questions, guys, and y'all tell me no. But anyway, those are my tips for studying the Z codes. Get familiar with them. That's the best thing you can do for yourself, because then that way you can understand, okay, yeah, I remember there's a code for that. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.